Hello everyone, my name is Sherifat Absalam. I have my badge on me, no nail polish. Today I'm here to perform IV insertion and discontinuation skill. I have verified my physician's order to make sure it aligns with the medication administration right. I have my supply, hand sanitizer. This cup is going to serve as my sharps container. The bag is going to serve as my receptacle for trash. I have my gloves. I have the IV catheter set, and I have the IV startup kit. I have my 0.9 sodium chloride solution, and the needle I'll be using today is the 22 gauge. It's by 1 inch needle, and this is because we might have the need to do IV blood transfusion in between, or even take order for labs, so that one will help with that. So after that, I have my tape, I have my pen, my patient is here. Gather my supply, go to the patient's room, knock knock, provide privacy, introduce myself to the patient. My name is Sherifat, your nurse today. Identify the patient's two-way. Patient identify using the wristband. My patient is Mrs. Smith. I'm going to explain the procedure today. Mrs. Smith, the doctor has ordered that I set up an IV line, and this is needed for in case we have to do medication administration, or in case we have to do some blood drawn. So the doctor has ordered that for you. Do you have any known allergy? Patient said no. Do you have any question for me? No. Can I proceed? Yes. After I've done that, I'm going to perform hand hygiene, and I'm going to wear my gloves. Once I've worn my glove, my next step is to set up. What this is going to do is to make sure I have the tube set up to make sure there is no bubble in it. This is an aseptic procedure, so I've made sure I've sanitized and sterilized the whole surface. Everything here has been sterilized and clean. So I'm going to take the tubing out. I'm going to remove the solution, and I'm going to uncap it. So for this solution, I'm going to ensure I hold the tip because it's an aseptic technique. I want to make sure this part that is going into the needle is sterile. It can't be touched after this is done. So take the cap off first. So once that is secured and is fastened, before I take the cap off, I'll make sure it's gentle. And I'm going to take this cap off. Like I said, what I want to establish is that there is no bubble in the tube. So how I'm going to confirm that is to ensure that liquid came out, and it came out twice. So that means the tubing is intact. There is no hair bubble inside. Make sure this is placed, nothing is touching it at this point in time. So after that, I'm now going to visually inspect my patient. I'm going to take out my starter kit, perform visual inspection, make sure the skin is intact, there's no bruise, no bleeding. And then I'm going to apply the tourniquet, and I'm going to apply that 4 to 6 inch from the sites that I've located. That is going to be the venipuncture site, and I'm going to strap that. The strapping is not going to be too tight. It's not going to be too tight. I'm also going to feel for pulse. That way I can know that the tourniquet is not too tight. I'm going to feel for pulse distal to the tourniquet side. Once that is achieved, and I've identified a location where it's going to be the venipuncture site, I'm going to now proceed by sterilizing the surface. If I were to use the Provident iodine, I will have done the sterilization by cleaning it back and forth for like 30 seconds and allowing it to air dry, but I'm not using that today. Today I'm going to be using the aqueous swab, and this one for the cleaning, I'm going to clean from inward to outward in a circular motion. and allow to hair dry. So once that is done and I've seen that, I'm going to take my needle. Take out my needle. Ensure that the bevel of the needle is up. And with my non-dominant hand, I'm going to hold down the skin for about 1 to 2 inches prior to inserting the needle. Once I hold, not too tight, it's just to taut the skin so the needle can go. I'm going to go in at a 30 to 40 degree angle, and then Miss Smith, I'm about to insert the needle. You're gonna feel a poke, and then once I go in, I'm going to advance about 1 to 2 inches. Once I see a flash of blood, a flashback, that means the needle is in the vein, so which means it's secured. I'm going to advance further about a 1/4 of an inch, no more than that. Once that is done, with the skin still held down, I'm going to ensure I gently remove. That's the clip I want. I'm going to put the styler in the sharps container and then release the tourniquet. Once that is done, I'm going to quickly take the blue lock, and with that my non-dominant hand, I'm going to secure and make sure it's sitting and resting well on the venipuncture site. So once that is done, I'm going to now ensure that the site is the line is free, and this I'll do by first aspirating. I'm aspirating and I'm seeing blood, which means the line is still open. Then I'll start pushing in the fluid gently just to make sure there is a line that is open and there is no blockage in between. Once I've done that, I'm going to clip the catheter by securing it with the clip. Once that is secured, I can now take off the syringe, put in the sharps container, and place this right over the patient's skin. Once I've done that, I'm going to take the tegaderm and I'm going to quickly secure the site and make sure there is no movement. Once that is secured, I'm going to take the top part of it off and take that round. And while taking that off, I'm still securing the tegaderm, so it's well secured there. The tegaderm already have a tape on it where I can put my date and time. Before taking out the paper, I'll have written that. I'm going to put my initial, the date, the time, the needle gauge I used, and then I'm going to place that over the tegaderm and make sure it's secured. Then I'm going to use the other tape I'm going to use the tape to also secure the remaining part of the tube so it's not moving around. I'll take off the tourniquet and make sure the site is secured. That one will also go into my receptacle. Once that is done, Mrs. Smith, are you okay? Are you in any pain? I'll make sure my patient is secured. No complaint of pain or anything. Once that is done, I'm going to make sure I put the patient back in a comfortable position. I'm going to gather all my used supply. I'm going to ensure the whole site is clean, gather my used supply, and then remove my gloves, perform hand hygiene, and document. What I am documenting is that the date, the time, the gauge, and the needle I used. I'm also documenting how the patient tolerated the whole procedure. If they're in pain, whatever patient teaching I provided, I'm going to document at that point in time. Take all this out and trash. Now the doctor has given another order to discontinue the IV. What I'll do, same process, verify that order that it meets medication administration right, gather my supply for this procedure. I'm going to have my sharp container, which is still here. I'm going to have the sanitizer for my hand hygiene. I have a 2x2 gauze here that I'm going to use, and then I have my tape, which I'm going to use as well. So same thing, go into the, and I have my gloves. So same thing, go into the patient's room, knock, knock, provide privacy, introduce myself. My name is Sharifa. May I know your name and date of birth? Patient identified himself with verifying that with their wristband. Once I've done that, I'm going to explain the procedure to the patient. Miss Smith, doctor has ordered the discontinuation of your IV line. I'm here to do that. It's going to take us about, like 5 minutes. But what that means is I'm going to take out the nodules, so you might feel some discomfort. Let me know if you're uncomfortable at any point in time. Can I go ahead? Do you have any known allergy? No. Can I go ahead with the procedure? Yes. Do you have a question for me? No. So I'm going to perform another hand hygiene, and I'm going to wear my gloves. So for this one, now that I've worn my glove, I'm going to first inspect the skin, make sure the skin is intact, there is no bleeding, there are no issues. Once that is done, I'm going to take the tape. All the tape I'm going to take parallel to the patient's skin so I don't cause a tear. Miss Smith, I'm about taking off the tape. I'm going to do that gently. Take the tape off. Prior to that, prior to taking off the, prior to removing the needle from the VAD, the venipuncture site, I'm going to clip the tube so that whatever IV is left is not going to splash out and mess up the whole place. So I've clipped the tubing, the catheter, I've clipped it, and now I'm going to remove the tegaderm, and I'm doing this parallel to the skin. And I'm using both my dominant and non-dominant hand. I'm interchanging to secure the needle so that it's not moving, that will cause irritation to the vein or the skin. So I'm removing parallel to the skin towards the center, and I'm removing gently. So once that is out, I'm going to take my 2x2 gauze, fold it neatly halfway. I'm going to place this over the needle site. I'm going to place that, and then I'm going to gently remove the needle. Mrs. Smith, I'm about to take the needle off, out. If you feel any pain, please let me know. Gently and slowly, I'm going to remove the needle. And once I do that, I'm going to apply pressure on the site for about 30 seconds. While I'm doing that, I'm going to check the needle, make sure The needle integrity is intact. There is no breakage. There is no bending. And once I've established that, I'm going to throw that in my sharps container. It's 30 seconds. I'll check the skin. There is no bleeding again. And then I'm going to throw this in the stretch table. I'm going to fold another 2x2 gauze right over the side and secure that with a tape. This is because of any further bleeding that might happen. That place can hold it, and then the sides can be well secured. Once I've done that, I'm going to put a tape over the site and make sure it's well secured. Patient is fine. Are you okay, Miss Smith? Any pain? Patient said no pain. Patient is fine. Skin integrity intact. No issues at this point in time. I'm going to remove my glove. I'm going to perform hand hygiene. I'm going to place the patient in a comfortable position so that if they need anything, Miss Smith, if you need help, just use the call light. Place the patient in a comfortable position. Now I'm going to take all the used supplies, leave the room, provide privacy, and then document. What I'm documenting is the date, time, and how the patient tolerated the whole procedure, if there is any teaching that needs to be transferred to the oncoming nurse. Thank you very much.